be sharing with you today things about premature babies and the complications that they face. My sisters and I were preemies. We were born at 25 weeks and were considered micro-preemies. We stayed in the NICU for around 3 months, and Alicia was 1 pound 6 ounces, I was 1 pound 9 ounces, and Amelia was 1 pound 10 ounces. A premature baby is one that was born before 37 weeks. A typical baby is not born until at least 40 weeks. The earlier the baby is born, the more complications that it has. Researchers from the March of Dimes say that around 380,000 babies are born prematurely in the United States alone. Today I'll share with you some of the complications, medications, and procedures that help premature babies survive and thrive. Premature birth is a complicated problem that does not have a single solution. Some complications that babies face may be apparent at birth, but others might not develop until later in life. There are many short-term and long-term complications that burden premature babies. Some short-term complications that preemies face are breathing problems, heart problems, and brain issues, and temperature control issues. Some premature babies have trouble breathing due to underdeveloped lungs and that their lungs might not be able to expand or contract correctly. Premature babies also have heart problems. A common problem is that they have low blood pressure. They also have PDA, patent ductus arteriosus. It is a persistent opening between the two major blood vessels that lead away from the heart. This defect can close on its own. Premature babies also have brain issues. If the baby is born earlier than expected, it will have a greater risk of having an interventricular hemorrhage, or a brain bleed. If the hemorrhage is smaller, it can usually be resolved with short-term impact. Larger brain bleeds lead to surgery and can cause permanent brain injury. Preemies also struggle with controlling and maintaining their temperature. Because they don't have stored body fat as a normal full-term baby, the preemie babies can lose body temperature rapidly. If their body temperature drops too low, they can go into hypothermia. They cannot regulate their body temperature because they're small and require the assistance of an incubator to stay warm. Some of the long-term complications that premature babies face are vision problems, impaired cognitive skills, behavioral and psychological problems, and chronic health issues. Some premature babies have vision problems that can last all throughout their lives. They can develop retinopathy of prematurity, which is a disease that occurs when the blood vessels in their eyes swell and overgrow in the light-sensitive layer of the nerves at the retina. Some of these abnormal vessels can scar the retina and can pull it out of its normal position. This can cause retinal detachment, which can impair vision and lead to blindness. Babies that are born prematurely are more likely to have behavioral or psychological problems than babies that were born at full term. Preemies also are more likely to have chronic health issues like asthma or feeding problems. Now that you have a better understanding of the complications that premature babies face, let's discuss treatment options for these issues. Healthline, which is a website that is medically reviewed by doctors and surgeons, tells that patent ductus arteriosus can be treated with medication called indomethacin, which ductus arteriosus close. Some babies need to be placed in an incubator. The incubator, they stay in this enclosed plastic bassinet, which helps them maintain a normal body temperature. Preemies might also need a feeding tube. The feeding tube can give fluids and can be maintained through an IV. Some preemies have an underdeveloped ability to make their own red blood cells and require a blood transfusion to raise their blood volumes. To treat underdeveloped lungs, doctors squirt a liquid into their preemie's lungs to help them mature. If needed, a fine mist or medication through their IV can be given to strengthen their breathing and heart rate. In some cases, they are given antibiotics to get rid of or prevent an infection. The Mayo Clinic states that some preemies might need to spend some time under bilirubin lights. These lights are used to treat infant jaundice and will help break down excess bilirubin in the baby's system because their liver can't process it all. Complications that arise cannot be fixed by treatments, might require surgeries and procedures for the preemies to become healthy and happy. Diseases such as retinopathy of prematurity sometimes require surgery to prevent blindness or vision loss. Because there are varying degrees of retinopathy of prematurity, each surgical approach is different. If patent ductus arteriosus cannot be closed with medication, surgeons will use a cardiac catheter in the infant's chest so that it does not have to be opened and they have a quicker recovery time. Some surgeries can be done to treat worsening hydrocephalus by placing a tube called a shunt that will drain the excess fluid from the baby's brain. Now that you know more about premature babies and the daily challenges they face, here are some ways that you can help. You can donate to an organization like March of Dimes, which is a foundation that develops new ways to help prevent or treat common complications of prematurity. Another way to help families and hospitals that care for these babies is to make hats and blankets for preemies. We're fortunate to live at a time that advances in procedures, surgeries, and medications are available for infants that are born prematurely. I'd like to thank my audience for watching my final speech.